guys, welcome to the Inspiring Minds coaching. And now the second topic of second content of the lab technique in the microbiology I'm going to discuss. As in the last video I discussed about the microscopy. I told you that microscopy itself is very important, and it is also when you go to the other subjects like radiology, pathology and internal medicine, and also somehow when you deal with the anatomy or clinical anatomy, then you will see their applications. So here in the topic of the staining technique, just I'm going to discuss about these things, and in the remember the previous one, that the microscopy, and in the end I will tell you how to use them while solving the question and how to take them in the concepts to retain in your mind, so that you will spend less time to revise them. Okay, let's begin. Basically, lab technique is something which you are going to which we do in the labs. Okay, so that biological labs, they contain lots of apertures. So keep in mind that there will be the formaldehyde, microscope and other appliances. Okay, so let's start from the staining technique. As in my second video I told you about the gram staining and the concepts behind that, the classical gram stain, modern gram stain, and the question point of view which is being asked in the CROC and IFM and USM examinations. Okay, in the staining technique here there is a varieties of, you can say, the categorization of the staining technique has been given. The first one is simple stain. Simple name itself says that it is simple because there is not lots of staining dyes and complex methods are used. They are simply you can use compound microscope and you have a simple kind of stain, and then you will get the result. Okay, simple stain is the first one when it was discovered at the time of the gram stain. That just you can say the more precise before gram stain, and it contained the basic fuse chain, the methylene blue. Remember guys that methylene blue was also in the gram stain and also in the Romanovsky acid resistance stain, so acid fast stain. So here that methylene blue is used. See why this one is very effective, that basic fusion. A lots of time when you see the question, just if you leave the question sides, just tell the concept behind that, then that methylene blue have the strong capacity to stick with the cell surface or the cell wall or the microorganisms, especially in the bacteria. Okay, so that you can identify that there is bacterial infection, or in the simple words, there is bacteria present. Okay, that's why methylene blue is most widely used in the area of the dyeing or staining. The second and from second one there is lots of concepts are there, and according to the questions point of view, simple stain is outdated, and nowadays there is no more question from the simple stain. Every time you will get from the either you will get from the differential stain or granular stain. Granular stain, pathological point of view, and differential stain when they will ask you in CROC 1 questions. Okay, so here in the after simple stain, the second one is a negative stain. What does it mean, negative stain? Negative stain means something when you use to identify something, like you know that there is organisms present, but there is subdivision of those organisms, then you use a particular type of agent, and if that agent bind with those organisms, like you can say somehow similar to the antigen specificity. For those who know the immunology, I will tell later, but just you see in more common way, like you have key. Okay, there is a lots of locks, but you have a key and that key is specific. So on the behalf of specificity, you can say that yes, that locker you can open from that key, and another one is not from can't be opened from that key. That's why that one is a positive. So negative stain is very famous in NEET PG examination, and they most oftenly ask with the name of either Indian ink or nigrosine. So I will request you to keep in mind nigrosine. Most oftenly they ask question nigrosine when you will see the question asked in the CROC and USMLE pattern. But when there is NEET PG examination FMG, then there was a question on the name of the Indian ink. The third one is impregnation stain. Impregnation stain, the concept behind them, that what does it mean impregnation and what we need. See guys, remember my first video, I told that microorganisms they are so much small, and think about their cellular, subcellular structure: cytoplasm, endoplasmic reticulum, and ribosomes, and other organisms which they have. So simply what mean that when you have a strong dye or strong agent which is being acting over the surface, they may damage. And once they damage, and in the final step like decolorization and molded or and fixation, you will not get the proper living structure. Okay, that's why it's very important for you to keep that structure so that your diagnosis will be the confirmed and it will be accurate. So here, if what happened in simple staining, why here these things are more advanced compared to the simple stain, because you are going to use the methylene blue. Remember that in gram stain also, you know the bacterial property, and a bacterial cell, they have a retaining capacity of the primary stain, and they are not going to decolorize when you use mordant and after then decolorizer in the form of halogen, iodine, and with the heat. But what happen if some structures are there and they are having very small existence, very minute existence, but when you use the acidic alcoholic things and they simply remove it from there, as the result you will get the wrong report, and you will not, maybe you will miss something. That moment you need the impregnation. Impregnation simply means here is done with silver. What they do, like they are here is a, it is a thin structure. In impregnation stain, we apply the impregnation, and what does it do? It just like it is silver, what it stick over the surface like this way. Okay, so when in the final step of when you observe through the compound microscope, at that moment you will see the thin layer like a thread of the silver. Most probably they are used for the identification of the flagella I have mentioned here, and that is bacterial classification, spirochetes. See, many times spirochetes comes. So keep in mind spirochetes and spirochetes, there is like canadosis and vibrio, all these their derivatives. These are very important. If I tell you my personal experience while solving the questions, what I do, I'll start from the end and comes to the beginning. Like I pick an example. Any if I take the example of the gram positive bacteria, then I will go the example. Okay, and like I took this streptococcus. From then I go to the backward. So from this I can see that yes, I used to remember all these things which is their existence in the microorganisms. Remaining is your choice how you take it. Either you can go from further top to bottom, either bottom to top. Ultimate target, you have to remember these concepts. The fourth one, differential diagnosis. Differential diagnosis is term used in the pathology and internal medicine, and in the clinical aspects of the differential diagnosis, what we do, we have a specificity with the some particular type of microorganisms. They are causing disease, or they're having some biochemical properties, and what we do, we just do that test to specify, like to be more clear, and in clinically more, if you go to the real cases. So what happened, someone is having a infection. Okay, you diagnose that, yeah, that is bacterial infection. So that moment you treat some patient with kind of disease, like you use streptomycin. Okay, and what happened, that drug, and what happened, that drug is even, it is not effective, and still that disease is showing its symptoms. Then what you do, before applying the another, that simply means you are not going to apply the broad spectrum antibiotic or broad spectrum drugs. First you will diagnose, because a good physician is that who know the accurate effect and use less and accurate drug, as you can see specific drug. So what do, you will just have that sample again, and in the laboratory technique you will just order that differential test or differential diagnosis for that particular smear. They will do their staining process. Suppose that there was bacteria, but in the differential diagnosis they found a gram negative bacteria. Okay, that gram positive, gram negative bacteria. Like in differential diagnosis, either another thing, it may be acid fast producing bacteria, or maybe not producing bacteria. Like if they are gram negative bacteria, then you prescribe the doxycycline, that is the drug. That's why the microbial complex or microbial concepts are very useful while treating a disease. To be honest, as a medical student or in doctor, you can just apply the broad spectrum antibiotic, and lots of drugs are there, but that is not a good way, because you are going to treat a human, then you should or you must be precise while giving the drug. Okay, that's why all these things are very important to check and to go ahead with the proper diagnosis. So in the differential diagnosis, what in the implication we got the flagellar reflex, like flagellar structures this way. Okay, and the fourth one is differential stain, where one is positive and another one is negative. I told this example in my previous video, and also gram stain concept in the second video, so you can watch that. And later the last one is granular stain. Granular stain is very much useful in the pathology, and also you will see when there is in immunology. Why granular stain is very important? In my last video I told you about granular staining or granulation. Actually, why we are studying these subjects? Because we are going to appear in the examinations, and after then what we'll do, we will be in the hospital, maybe some of you will be in the clinic, or the great doctors and physicians. So at that moment there is always some kinds of things which you will use in most of the time you will face the infectious diseases. That is another thing. You remember the drug name, and there is a lots of pharmacies and other products you are going to prescribe. But before that, you need to know that that is infection, or that is traumatic condition, or there is deficiency, or there is excess, hypo, or somehow isotonic. So all these things important in the clinical biochemistry. Okay. If you want the clinical biochemistry, you can comment in the comment section, and I will take I will take one video. I'll make one video, and will give you the laboratory reports and how we identify that yes, that is infection due to the bacteria, infection due to other things. It is not infection. It is body abnormality in liver, kidney, or somehow you can say the glandular liver. It's very interesting, because here we are going to deal with the real questions and the real human like patients. But examination point of view, these concepts are very important, but when you go to the real applicative part, that moment these concepts needed. Granulation simply means you are going to count the granular structures. What are those structures? In my previous video I told you about the WBC. If you remember, white blood cells, those white blood cells, they are differentiated into granular and agranular. The granular one contain basophils, eosinophils, and neutrophils. Basophils, further it goes in the modification, and eosinophils and neutrophils, they have a strong impact against infection. Any kind of infection is there, then they will act over them, and there is cell mediated immunity. In immunology I will tell you, and later they will form a antigen antibody complex, right? So granulation, why it is important to understand, somehow how someone is having clinical symptoms like fever, or they are the broad symptoms, okay, like fever, diarrhea, or someone is showing symptoms of nausea, fatigue feeling. So at that moment it doesn't mean that there is no simple one disease you can say yes, that is that one disease. You will have to diagnose that, and in the diagnosis point of view, you will have a single result, and then you have to diagnose, or you have to prognose that thing. The etiology of those diseases are very important for you to understand, because you don't have that object or that subject to investigate in the lab. Okay, so in the granulation period, what we have, simply we have CBC report, and there will be the increased number of the WBCs, increase the degradation of the WBCs. Comparative, there is degradation, or RBCs destruction. You will say declare that yes, that is anemic condition. When there is WBC destruction, or the amount is a sudden increase in peak level increase and then decrease, you will say that there is an initial phase of the infection, and later there is severe chronic phase. Personally, I have seen few reports, and where in the case of the typhoid and cholera, the initial state, the WBC amount will increase, because T4 receptors in the cell, they will give the cell mediated immunity, a reflex or induction, and they will produce their amount, and in result you will see the CBC blood report that there is increased amount of the WBC destruction, and you will declare that is infection. infection point of view, granular is very important. And in USA, UK, even in India, infectious disease department is very and very important. Even also nowadays, small, even from the birth, early life, there is infection. You have to avoid from the infection. A lots of infections are there, so you can't ignore it. So granulation is just one thing to identify infection, is that present or not. Then for more specificity, you are going to use another method. Okay, in the granulation period, they simply we have, in examination point of view, the first one, Giemsa stain. I told you in my last video that Giemsa stain and the Neisser stain, Loeffler, Albert and Ponder, they all are directly related to the WBC and cytoplasm and their granular structures. See guys, last video and this video I have made it just in combined. This chart, if you remember, definitely you will be able to solve questions. Just let me tell you that questions which is asked in the examinations. Here the optical and light microscopy have been used in many microbial methods, and they have been asked in the croc questions. So in the croc point of view, optical and light and fluorescent, the second one. The how they will ask in the IFM questions and USMLE questions, fluorescent microscopy, they are very important. They are very interested in asking the question of basically, especially based on the antigen antibody. Okay, and in the croc question, last year question was their phase contrast, and they ask they ask which kind of microscopy is used. That was phase contrast. Why? Watch my previous video. There I told you, based on refractive index. Who's a refractive index? Bacteria and medium. They just made a scenario that in bacteria there is a sample bacterial refractive index. They said the medium difference, and because of that you said that, yeah, that is phase contrast method. The last one, dark field, it is also very famous in the croc and NEET PG examinations. The electron microscope is very, you can say itself, no one is going to ask you directly that tell me about electron microscopy. There is always ultrastructure of electron microscopy, and they will ask about them. Whenever there is staining questions, simple staining, impregnation, negative staining, differential staining, on the exams point of view, you will find that negative stain is very important when you solve the questions related to the capsules and in NEET. Okay, but when you solve the question of the croc, at that moment nigrosin stain, definitely there is a question, and I will tell later in next video question discussion. And impregnation stain is somehow outdated, and they are not asking this question in the last 5 to 10 years. And the last, differential stain, this one is very important from exam point of view in all exams. This, no doubt you will have to remember this. Just remember my bonus round in the last slot. I gave you 5 lines to solve all questions based on stain, and this is part of one. Gram stain, positive violet, negative red, and acid fast in croc, that is known as Zillinson. In IFM it was asked in the acid fast stain, basically for the TB, Mycobacterium tuberculosis. And in the USMLE they also ask question Mycobacterium tuberculosis is specified test. This was used, so you can't escape these things. The differential stain is very important and also very interesting when you go through the real life and IFM and latest questions. And the granular stain is very famous in croc question. Okay, especially in croc questions. Giemsa stain, Neisser stain, they are even, if I am right, then there was every year question from the granular stain. And so guys, here I gave the compact things of laboratory technique, and the first I told about the gram staining and gram bacteria physiology and morphology. So in the trick section I mentioned, read the marked content, I told you, and revise it and apply it over the questions. You will get the answer, that is my guarantee to you. And somehow if there is some kinds of confusion like trypanosomiasis, this difference, disease caused by them, their name, they are so tricky questions. So somehow what you will have, sometimes you will apply these things, and in the example section you may step. Don't worry, I'll explain everything, why, where you did the mistake, but in 90% cases you will solve all questions based on the first one, lab technique, and the second one, stain. Okay, so hope you guys like this video, and this was really very important for you to exam point of view. In the next video I will cover all those questions which were asked from the microscopy and lab staining technique, and definitely it will help you. You have any kind of doubt, if you want any kind of more detailing in the concepts, I'm here. You can comment in the comment section, and like, share and subscribe this channel, and keep watching that Inspiring Minds coaching. We are here to give you the quality content. Thank you.